Thank you all again for having me here tonight virtually. First, I need to congratulate this year's first awardees of the Big Data Big Impact Award. Of course, I'm very excited about this award. But of course, I must congratulate the Cancer Institute New South Wales for even offering an award like this. It's one of a kind that I know of in the world. It's been a year since I've attended the Cancer Awards last year, and what a year it's been for big data and open data. Here in the United States, we've seen the White House start to mandate that research-funded publications will need to be made open access after 1 year of publication. We've seen a lot of press out there on this policy, with some saying this is great news, some saying this is selling out to the publishers for not being sooner than a year, and others actually saying this is not even a real event, as investigators funded by NIH already had to share their publications. But hidden in the White House text was the requirement that the data behind those publications will also have to be made available within a year. In the cancer area, we see amazing new and growing resources like the Cancer Cell Line Encyclopedia, with genetic details on thousands of cancer cell lines. But of course, the flagship database I have to talk about tonight is the Cancer Genome Atlas, with data from nearly 20,000 samples and individuals across more than 20 types of cancer, with DNA and RNA measurements, imaging, and so on. And indirectly related to cancer research, we see new types of data. New data sets like the Encyclopedia of DNA Elements, ENCODE, with 15 terabytes of raw functional data related to DNA activation and function. We have the Library of Integrated Network-Based Cellular Signatures, or LINKs, with thousands of drugs and RNA inhibitors tested against dozens of types of cells and cell lines, including cancer cell lines. All of this functional data is not necessarily cancer-specific, but directly related and relevant to the study of cancer. What's next? I'm actually betting that the next big open public data revolution will be clinical trials data. We all know that half of clinical trials actually fail. Many never even reach the stage of a publication. And we see increasing calls from journals and funding agencies trying to get their investigators to release raw, individual level clinical trials data. And we're not talking about identified data, we're talking about de-identified data, but I think this kind of new data will launch its own scientific revolution, with third-party investigators learning why these trials are failing, maybe learning subsets of patients that will benefit from drugs, and then testing those virtual subsets in other trial data. There's no reason to fear any of us trying to figure out who these individuals are, of course. This is science we're talking about here. And maybe this type of new science might drive forward personalized medicine or precision medicine of the future. In some ways, big open data is one of our most important exports for your country and mine, as the right trained individuals in our countries and the rest of the world have a hope of using this data in new ways to generate drugs and diagnostics from which we can all benefit. In this way, the real value of big data is in the results of the actions that data generates. There are other fields, for example, where we have plenty of big data, but plenty of inaction, like economics and climate change, for example. What precision medicine and personalized medicine really need, this new field of medicine really need, is courage. People and groups do have interest in the inefficiencies and in the status quo of how medicine is practiced today. And people do feel that data is power and don't necessarily want to share that power. So it will take courage to say that you have to share data. It'll take courage to open things up. We also can't start data analysis with big data when we've reached perfection. It's the quote from Voltaire that perfection is the enemy of the good enough. And it'll take courage from all of us to get started when we don't really have perfection, or we haven't reached perfection in our methods or abilities, or the exact quality of the data and data analysis. And we're all thinking in our field how great it'll be to use big data someday to eventually say to a patient, yes, you can get this drug. But it's going to actually take a lot more courage to say to a patient, no, you really can't have this drug, and we really don't have anything better for you yet. And that's why I think, in closing, I want to congratulate the Cancer Institute, as well as the new awardees, as being among the most courageous of researchers today. Not just making a difference for cancer patients and showing the way for other investigators in many scientific disciplines, but really showing how scientists can really try to change the world for the better. Thank you.